The cardiac conduction system of the heart is a vital system that controls heart rate and cardiac output. The components that make up the cardiac conduction system are the sinoatrial node, which is the pacemaker of the heart, the atrioventricular node, the bundle of His, bundle branches, and Purkinje fibers. The SA node is a cluster of specialized cells in the right atria of the heart that fire action potentials, which travel through the muscular tissue of the atria via the intercalated discs, allowing the atria to contract. There is a layer of insulation that does not allow this initial current to reach the ventricles. The current is carried into the ventricles down the bundle branches through the AV node, which slows down the current 1/10 of a second, then allows the current to continue down and the ventricles to contract. The electrical activity of the heart can be monitored using an electrocardiogram. A normal conduction sequence on the EKG is as shown, with that same sequence duplicated over and over. There are three main waves, the P, QRS, and T. The beginning of the P wave is where the SA node sends out a signal. Then the PQ segment is the signal traveling through the atria, causing it to contract. The Q wave is where the signal moves through the AV node and down the bundle branches, and the R and S waves show the initial left and right ventricular contraction, which continues through the ST segment. Finally, the T wave is ventricular relaxation. Second-degree heart block is a pause in the cardiac conduction system, particularly in the AV node. There are two types. In type 1, the SA node still functions normally and sends a signal through the atria, causing the atria to contract. However, once the signal reaches the AV node, the signal slows and the node does not function properly. The EKG for this type of electrical rhythm is what most physicians use to diagnose this condition. The EKG shows what looks like normal electrical sequences. However, when you look closer, you can see that the PQ waves get longer and longer and longer until the QRS wave is skipped altogether. This is due to the AV node getting overworked and needing to take a rest. Think of it this way. We are all students. When we start a semester, we are determined to do well. We go to the first day of class, cheery and ready to take on the semester. As the semester goes on, we get worn down. We don't get rest, and we start not to function as well until eventually all we want is sleep. The pattern in the electrical flow for type 1 second-degree heart block is very similar. It works harder and harder and harder until it can't anymore, and it needs a rest. Type 1 is also known as Mobitz 1 or Wickenbach. Type 2 second-degree heart block is very similar. The SA node still functions and the electrical signal still makes it to the AV node. However, there is yet again a dysfunction in this AV node region. When you take a look at this EKG and label all the separate waves, you see a weird pattern. There is only a QRS wave every other P wave. When the AV node generates one signal, it needs to rest each time. It doesn't have the strength to do more work right away. It needs to take a quick rest, and then it can function normally again. Type 2 is also known as Mobitz 2.
So what are the causes? Second-degree heart blocks can either be congenital, defects present at birth, or acquired over time. Some children are born with congenital heart disease or congenital heart block. Babies born with congenital heart disease or heart block are typically born from mothers who have an autoimmune disease, such as lupus. Luckily, the probability of a child being born with congenital heart block is anywhere in between 1 to 5%, and that is only accounting for the children born from mothers with lupus. A few examples of acquired causes are those that result in damages that form during a major heart attack, Lyme disease, or medications used to treat other disorders. Lyme disease, the spread of bacteria through tick bites, can be caused through Lyme carditis, which is inflammation that can block the electrical signals needed when the bacteria enters the heart tissue. Medications such as amiodarone, used for abnormal heart rhythm, and pentamidine, used to treat certain types of pneumonia, are common culprits. Medications with the highest cause rate are calcium channel blockers, used to treat high blood pressure. These include amlodipine, which dilates the blood vessels to create an easier flow, and diltiazem, which relaxes the muscles of the heart and blood vessels to treat hypertension. Now, the treatments of second-degree heart block are limited. Most commonly used for congenital cases, the heart block will be treated with a pacemaker, which is a small device that sends electrical signals to regulate a normal heart rhythm. As for the acquired cases, heart blocks can go away over time if the factor causing it is treated or resolved. For example, heart blocks caused by heart attacks can go away during recovery, and blocks caused by medication can stop if those doses are either lowered or stopped altogether.
Although a second-degree heart block may sound intimidating, it's often not a huge concern. With close monitoring from your physician and a healthy lifestyle, you can live a long and happy life.
Yay!